Hey everyone, welcome back to another episode of the National Council on Interpreting in Healthcare's podcast called Interpreting in Healthcare. We have a really interesting guest today, not only for the type of work that she does and her background, but also the languages that she speaks. And I am speaking, of course, of Zenab Khouder. Zena is a certified court interpreter who has proudly served the Arabic community for 20 years as an interpreter and translator. Seeing the great need for the training of interpreters, particularly in that language pair, Zena, you began serving as a coach and trainer to several national and international organizations. Briefly going through your timeline in 2000, you started as an approved court interpreter in Texas, and then in 2002 studied interpreting and translation in Austin at the community college there. In 2016, you became provisionally qualified in the Superior Court of California. And the following year, 2017, a language skilled USDC federal court interpreter. And 2017, again, the CCHI core certification. And then in 2019, you were certified by the state of Illinois Supreme Court. And in 2019, started your own YouTube channel. And that's, I think, where I first saw you and been keeping an eye on you ever since. In 2019, you also were a community interpreter trainer at the Orange County Department of Education. And the following year, 2020, certified by the state of Arizona in the Supreme Court. Nice. And 2020, CHIA's Interpreter of the Year. What an honor. And CHIA, for those of you who may not know, is the California Healthcare Interpreter Association. In 2020, the ATA Dynamo Award, American Translators Association, and 2020 instructor at Trans Interpreting, a language service provider. 2020, you were also a guest trainer at Prince Sultan University. What country is Prince Sultan?
Saudi Arabia.
Wow. And then 2021 presenter at the ATA's 62nd annual conference and registered by the state of Wyoming Supreme Court. So I see you're really accumulating lots of certifications.
Reciprocities.
And in 2023, the first Arabic staff court interpreter for the state of Arizona and the region. You're an active member of the American Translators Association and board member at the ATA for the Arabic Language Division, an active member of NAJIT, the National Association of Judiciary Interpreters and Translators, and active master level member of the American Alliance of Professional Translators and Interpreters, APTI, and an active member of the American Association of Interpreters and Translators in Education, AITE. I'm not sure if I'm saying that acronym right, and much, much more. So welcome.
Thank you.
Really happy you were agreeing to be here with me today.
Thank you very much for inviting me. I'm really proud to be at your podcast and to meet you in person, virtually at least.
Finally, after stalking each other on social media for a number of years. So looking back, and I see that your timeline started in 2000, and that too is about the time I returned to interpreting. I had done it after college and before graduate school, but then took another route into publishing and literacy and teaching of languages before I came back to my first love, which was interpreting and getting my first conditionally approved certification for state of New Jersey, and then working on the East Coast before coming out here to the West Coast and noticing the same thing, not enough trainers. 40 hours isn't enough training for a healthcare interpreter or a judicial interpreter, because we're talking about people's lives, whether it's the quality of their life in terms of healthcare or the quality of their life in terms of freedom or financial cost, financial harm. These are places that we need more hours of training, I think, for interpreters. as well as an awareness of exactly everything that goes into creating a talented human interpreter so that we can provide safeguards as people continually expand technology and move towards AI, automated interpreting and translation. I don't think we're quite there yet. I'm very excited about the possibility, but I'm also very concerned about people wanting to implement before it's fully tested, kind of thing.
Yes.
Yeah, because the guinea pig is a human being, not a guinea pig. So,
Yeah.
looking back, what sticks out for you as whether it was one or multiple moments that helped guide you in the direction you ended up going? Look back to 2000.
Uh,
Think
the
about
first, I think, interpreting job, I I was like what wasn't planned. I felt that interpreting chose me. I didn't choose it. I didn't know at that time what I wanted to be, and like really proud that I chose that career. It's a wonderful career. Like you said, it helps others due process in court or like patients who cannot talk for themselves. And I really love this field of life. And plus, in addition to all that, continuous education, which is like you're learning all the time. But starting was not that easy, especially for my language peers. We did not have anybody to guide us, and it was hard to get where I am now. It took me longer because I didn't have the guidance of a mentor or somebody to help me until I found some wonderful Spanish trainers that lended me a hand and helped me at least understand like the system and how to navigate around on how to look up my vocabulary. Of course, like internet helped a lot. And if you noticed, most of my achievement was at 2020. It was COVID when we were stuck at home, had to learn like virtual, uh, like Zooming and other
all
things
those
and
platforms. Yeah.
all those platforms. But for me, it was exciting and helpful to reach out of my state, out of where I am, like to multiple directions, whether international or national. And this is where I was happily blooming, and achieving what I wanted to achieve and trying and be able to help others, and lead them to the same path because we didn't have anybody else to lead me.
I'm struck by what you said until you found some talented trainers to mentor you. And it's okay that they were Spanish language speakers because I have found that for rarer languages, or what we in language access often refer to as
Mhm.
languages of limited diffusion, even though they're spoken by millions of people in the world, there still is less support. There's still fewer resources. It's still hard to find a good dictionary for medical terminology between Brazilian Portuguese and English, and I would imagine for Arabic and English. And I know from training students that have recently arrived from Afghanistan, I can't find any good resources in Dari or Pashto to English, even just a plain dictionary, never mind specifically towards the medical field.
Yeah.
So you were your own trailblazer. You cut your way through the jungle
Yeah, I
to
was
open up a
stalking all
path
those
for
nice
yourself.
trainers, and they were like let's say Edgar. I will follow him on every workshop. Please have something language neutral until he started. Like in the beginning, he will do Spanish, and when he sees me, I say, I want to buy my ticket in, and I want to come to your workshop, whether it's Spanish or not. At least I will get 50%. So like, and then he started giving language neutral, and other trainers started following him. But I don't know, like if there was others that I didn't know about, but from my researches, I didn't see anybody before, and I was really happy that I started comprehending and knowing how to navigate this thing. Like we are good at the language, but we don't know the skills of interpreting all the modes and other things. Even though I studied a little bit in college in Austin, Texas, we only had introduction
Mhm.
interpreting, and every time there is an exam or something, oh, we don't have anybody that speak your language to help you out. So the Spanish language was leading in this career. Of course, there was like the sign language, but this is a different field, I think. But like the Spanish was leading, and they had very knowledgeable and professionals, trainers, and this was my only gateway to approach my career and to advance it.
So you mentioned that a lot of things started happening in a good way in terms of being able to connect with more opportunities and more markets
Mhm.
in 2020. So that's not quite the present, but it's pretty close to the present day.
Yeah.
So can you tell us a little bit more about the now for you? It looks like you're all over the place, California, Arizona, Wyoming.
Yeah, it was not easy to get certified, even though they say that the 20%, like it's in court, I'm talking, the 20% chance of passing the exam. I think that's for Spanish. For Arabic, I believe it was like 2%.
Wow.
So for about 5 years, I didn't see anybody passing. And I was trying and struggling to pass. And uh, in California, it's led by the Judicial Council. They have harsher rules. So, like, even though I did the test there, I started seeking reciprocity with my grades that I got in different state to get better opportunities. And thanks to the virtual, reality now, I was able to reach out and do my exams either virtually, sometimes in person. And this is how I started like spreading to other state and finding other options. And I'm very proud of having the support of my family, my friends, the community,
So important.
the professionals that I like reach to. Uh, like that's how I started to thrive because I'm very ambitious. I'm like an entrepreneur that like to learn, and like it's not that I like to lead, but maybe I have like some part of me that be like very competitive. So I always try my best to achieve what I want and to excel it.
I think the interpreting profession, for those who stick with it ends up being a group of people that are curious, that are lifelong learners, and that also might get more easily bored at a job that would be exactly the same day in, day out, because that's
Mm.
one thing
True,
we
we
can
cannot do that.
guarantee: every
It will
day
kill
is
us.
different from the one before.
Yeah,
It
we have to
doesn't
be
matter.
meeting. Yeah, I mean, different people doing something different every day. Yeah, reading something different and exploring.
And interesting too how the pandemic pushed people, administrators, different areas where you can interpret to finally give up their resistance and go to video. I mean, there were people, I worked at a level one trauma center that initiated the ability to have a video interpreter in 2008. But here we were in 2020, and people still needed healthcare that didn't have COVID.
Mm.
And this was absolutely the solution: to have those well visits, to have those behavioral health weekly visits, to have those check-ins that are needed to maintain the rest of the population that isn't in intensive care with the coronavirus. How are we going to do this? We have to do it remotely. So those last strong resistors had to give way and allow this modality to become part of the services that they offered. And I really think that changed work culture, not just for interpreters, but for people to realize, I don't have to work at that McDonald's that I don't like. I can find 2 or 3 little jobs that I can do from home. But
Yeah.
more importantly, for interpreters that whose language pair is not Spanish and English, it gave us the opportunity to connect with sufficient amount of work that we can do interpreting and support ourselves in a decent way, take care of our family, be able to go on vacation, those types of things. So it is one of the few bright spots, I think, that
Yeah.
came out. Tell me a little bit more about what you
Yeah,
did
I
during
think
that
in
time.
every tragedy or like big life events, there is always a door of light opening, and you have to take that chance. So, like in COVID, it was, even though it was depressing, a lot of people got sick, a lot of people died, and even from my family members. But you cannot just sit and do nothing. And you cannot just, when you see others, excelling and learning new skills and getting new opportunities, you have to grab into that and get yourself out of it. You cannot just stay in the same place and resist. Like you said, some people were resisting. Yeah, you cannot just be an old fashioned and resist without learning, because you will die, like professionally and even emotionally and everything, if you don't keep learning and doing something new and evolving. We have, like, now AI. A lot of people, oh, it's gonna get our jobs, we're gonna stop working. No, only people who are gonna stop working are the people who are not gonna learn it. We humans are smarter than AI.
That's
AI have
exactly
different
right.
skills. We have to use it for our advantage and keep evolving with it. We cannot just sit at the same place and wait for something to happen. We have to make it happen.
I
And
totally agree. I used to say the same thing when we were introducing video remote interpreting at the hospital. Some of the older interpreters are like, oh no, this is going to take our jobs. And I was like, no, there's more than enough requests. You can see how many go unmet every day. There's more than enough requests to keep everybody busy. But somebody who knows how to interpret via video as opposed to only in person is going to have more opportunities to make more
yeah,
money. So
mhm,
it is an advantage. Look at it
yes,
that way and don't close yourself
yes,
off from opportunity and learning and growth, because growth is life.
yeah. Look at that. The bright side. It's gonna be additional help for you. Interpreting, to use an AI tool, to use any new technology coming. It's gonna help us. It might not. We might not like everything, but use the things that you can use and leave the things that you don't want to use.
And I am striving to make the connections outside of the world of translation and interpretation to the people that write the code, to the people that are rolling out these early versions, to say, look, here's the white paper that the National Council put together on concerns regarding automated interpreting and automated translation. And here are our suggestions to ensure quality. Everybody wants quality, right? You don't want a machine that
Mhm.
leads to some preventable death. Preventable death has to be the saddest kind of death that there is.
Mhm.
So, yeah, less siloing, more conversation amongst the people that work, even peripherally, right? Creating the programs, creating the apps that go on your phone
Mhm.
to listen to our voices and not just hear complaints after they roll out a product. Let's
True.
participate in this together. That's my challenge,
Yeah, my
currently,
challenge too.
trying to
Like I've
find
been,
more people to talk about this with.
yeah, I got like, as you notice, I became a staff last
Yes.
year. Actually, yeah, in let's say 23, I think, July. And for a while, I liked it because I loved achieving, being the first staff ever, and I wanted to try the experience. But I felt it's keeping me from doing what I like most, attending conferences and continuing
Mm,
learning and uh, being out in the field with others in different states and meeting all those professionals. So, like, for multiple reasons, in addition to this, I said, no, I need to go back and be a freelancer again, because this is the only way I can like thrive and attend all the conferences, meet with my fellow professionals, and learn about the new industry and development and expand my network. Because being a
Absolutely.
staff is not what I am. I found out, it was a short period, almost a year, but I said no, like because like this year I wasn't able to attend as many conferences as I wanted or take the classes that I wanted. Like it was really hard.
Yep.
Working from 8 to 5, you had to prepare. Like I felt like from 6 to 6, I am on a very short leash, and I was like I couldn't do it. So now I'm back and I'm attending all those conferences that I can. Of course, I'm a member of a lot of associations. I only gave you a few. and I'm happy that all those conferences, like I attended like 3 of them in Arizona, in California, and I'm also gonna be flying to Portland at the end of the month to ATA. All of them are talking about AI. And that's great because you're having different perspectives of AI. People who are developing, like you said, you're gonna reach out to some that will tell you what they are doing and how they think about it. Like they want to borrow your voice or your talent and put it in AI, and then there it is for there forever. It's not yours anymore. Or like other
Right.
people are, no, don't sell. Those are interpreters. Like, don't sell your voice. Make sure like don't, like, there is a way to do it. Don't do it the way that the greedy developers are using you for. Do it the right way so you can keep your job and be creative and add it to your skills, not take away some of your things. So I'm learning a lot, and I'm really really happy that I'm capable of attending all those conferences and meeting all those professionals and achieving and evolving.
So you've done quite a bit already. I feel somehow, even though I've known you just a short amount of time, you're just getting started. So when you look ahead, what is your vision? What is your mind map for the direction you're trying to move? We know when we envision, it doesn't always work out to the last detail, but the general direction, when you have something that is strong in your mind and your heart, you'll generally end up getting there. So what are you seeing in your mind's eye?
I'm getting older, so I'm looking at professional older interpreters. What did they do? What are they achieving? What did they achieve? What's like, so most of them became trainers to give back from their experience, than because like working is going to be harder when you get older, traveling from one place to another, and it will be redundant too sometimes.
Mhm.
So like I think I will be focusing more on my training, because I feel every time that somebody I help, like let's say for the written exam or the oral exam in the court, and I see that they passed and they achieved what they wanted, I feel happy for them. And I want to give more, and I find more students that need me. So I think like for me, training is going to be my future. Probably I'm still like dreaming about writing some books maybe, and putting some training materials like online. And I will for sure seek more reciprocity in different states. Those are the things that I'm planning to do. And I even attend conferences overseas in Europe, but they have great trainers and wonderful ones. So, like, I just want to follow the path and maybe create my own too.
That sounds fascinating. Maybe some kind of collection of trainers' stories in a compendium, a volume of, words of wisdom or something, a better title than that. But
Yeah.
a variety of trainers from different areas talking about, as
Hmm.
they look back, what stands out
Hmm.
to them that is of pivotal importance, and where they see things going, or what is still needed might be a great little collection for
Mhm.
trainers that are starting out.
Yeah, Holly Mackison is my like role model.
Yes.
But I was like, I love the way she trains, and I like everything about her. She's great, wonderful person. So like, and I just met uh, I think it's his name Nestor from Southern California School of Interpreting. He also told me like he retired of training and he's doing something else, also using AI. So like, yeah, I follow those great trainers and see what they're doing and try to achieve some of their achievements, or you never know, maybe one day I will be somewhere. My name will be on some of those products too.
A little star amongst other stars in the heavens of interpreter, mentor,
Yeah,
coaches, and trainers.
yeah.
Absolutely. Zena, it has been so much fun talking to you today.
Thank you. Thank you.
And I really hope we can continue our conversation after this podcast ends, because I think we think similarly about a lot of things, and maybe we can make something happen with training manual for trainers or
Yeah,
something else. We'll
sure.
see. But folks, stay
Yeah.
tuned, because this is just one of many podcasts coming your way. Zena, thank you so much for
Thank
being
you.
with us
Thank you. I really
today.
appreciate
Thank you,
everything.
everyone, members and general public
Bye.
alike who have tuned in. And stay tuned for the next Interpreting in Healthcare podcast, brought to you by the National Council on Interpreting in Healthcare. Ciao, ciao.
Bye.